It was initially described in Japan about 10 years ago, and it's not a new disease. IgG4-related disease is clearly a disease that's been around for well over 100 years and probably much, much, much longer than that. But if one looks at the German medical literature from the 1800s, one can see drawings of patients with swelling of the parotid glands and the submandibular glands and orbital pseudotumors, patients who clearly had what we now know is IgG4-related disease. And IgG4-related disease is actually very similar to ANCA-associated vasculitis, granulomatosis with polyangiitis, and forms of large vessel vasculitis, in that it is a multi-organ disease. It can involve essentially any organ in the body, just as granulomatosis with polyangiitis can, and it mimics granulomatosis with polyangiitis very well, actually. In some senses, IgG4-related disease really is a form of vasculitis, especially in the large blood vessels, in the aorta and the primary branches of the aorta. There's clearly vasculitis in those blood vessels. In smaller blood vessels, microscopic blood vessels, the small veins and the small arteries in some organs are also involved by a process called obliterative phlebitis in veins and obliterative arteritis with regard to arteries. So there have been probably 12 or 15 different disorders known by different names in the medical literature. Renal thyroiditis, known for more than 100 years, is actually IgG4-related disease of the thyroid gland. Sclerosing pancreatitis, or autoimmune pancreatitis, we now know is IgG4-related autoimmune pancreatitis. Primary sclerosing cholangitis can also be mimicked very closely by a disease that we now know is IgG4-related sclerosing cholangitis. And that's an extremely important distinction to make, because primary sclerosing cholangitis responds very poorly to medical therapy. IgG4-related sclerosing cholangitis responds wonderfully to therapy. One of the big eureka moments, well, out of many eureka moments over the last 7 years as I've become aware of this disease, was the realization that B-cell depletion works incredibly well in these patients. And we've developed a large experience now at Massachusetts General Hospital, where I am treating IgG4-related disease with B-cell depletion, and really understanding how B-cell depletion works and doing careful molecular studies of rather small groups of patients have led us to important insights about how this disease works. And it's striking that we've known about the disease. I saw my first patient with it only 7 years ago. But because of studying small groups of patients, but studying them well, we already have a very good picture of how this disease works. And we've described the importance not only of B cells, but also of the successors of B cells, plasmablasts, in this disease. And we've described a new, novel T cell, never described before in humans. And we think that this T cell has a very important role not only in IgG4-related disease, but probably in a lot of other human conditions too.